This is the Human Services Committee meeting, Wednesday, December 2nd. And we're going to change the agenda just a hair, but we will begin with approval of the minutes from our November 4th meeting.
Move to approve the minutes.
Second.
All in favor, aye.
Aye.
Opposed, same. Motion carries. This is an opportunity for public comment. Anyone in the public wishing to comment? Seeing none, we will move to the Health Department. Good morning, Fred.
Good morning. Fred Kiesler, Health Officer, Grand Traverse County Health Department. Because of schedule, first item to discuss in your packet is on page 17, and that has to do with the Grand Traverse Regional Healthcare Coalition Services Agreement. Traverse County Health Clinic and Coalition, which is known as the Grand Traverse Regional Healthcare Coalition Services Agreement with the Health Department. This agreement is to create a system for providing and arranging services for indigent persons who are unable to pay for such services. Local dollars are used for services for this low-income, uninsured, and underinsured. The total contract amount is $471,464. This is a renewal of this contract. The terms of the agreement are from January 1 of 2010 through December 31st, 2010. So I recommended that the renewal of the contract with the Healthcare Coalition be approved.
Is there a motion?
I have a question first. How does this compare with the amount for last year?
The amount from 2009 was $457,428.
And basically, this is all state money coming through the Traverse Health Clinic to the Health Department, right?
That's correct. What happens is the county treasurer actually sends county appropriation that we determine to be in support of low-income residents. It's sent off to the state where it's matched with dollars. It comes back to Munson Hospital, and then Munson Hospital has a contract with the coalition to provide services, and that's how they get a significant portion of their funding.
Okay. I'll make the motion to approve the contract.
Support.
Discussion. Hearing none, all those in favor, aye. Aye. Opposed, same. Motion carries.
The next item is to move the item on page 20.
Page 17. You misspoke the first time, Fred, but we caught it.
You.
It was on page 8 originally.
Sorry. The medical examiner appointment and renewal. So there's two aspects to this. Is Dr. Houghton, who has been a medical examiner for the past 4 years, needs to be reappointed as medical examiner for the county. And then the second portion is that based on a letter from Al Schneider to the county commission and a meetings I had with him, is he feels that under the statute, Dr. Houghton needs to be a county employee, not not a contractor. And so I need a resolution, first of all, approving, renewing his appointment for 4 years as county medical examiner. And then secondly, whatever legislation needs to move this on to have him instated as an employee. Dean Bob will be back later to discuss the details on this as to how I originally negotiated with Dr. Houghton on this. He didn't have a problem either way. He just wanted as long as it's the same, meaning his remuneration would be the same. And so we worked out a salary arrangement where he get a base salary and then an additional amount for every autopsy that he does or an investigation that he does. And which is basically the same as the contract read. And I was not familiar if county employees were ever hired that way, but there was some appraisers that are hired on doing base amount and then a per service done. Am I right on that, Dennis?
I'm not aware of that. There is an appraiser position that we pay a stipend to for extra work they do in East Bay Township, and that may be what he's referring to.
But-
They do equalization work, but when they're doing assessing work, they're paid separately.
a little disadvantaged because Dean was more familiar with that. But anyway, Dean met with Dr. Hogan's accountant and reviewed with him is exactly what he asked, because there'd be withholdings for Social Security and stuff that he didn't have as a contractor, but it basically worked out okay as far as what they could tell from his accountant, so they could proceed with that. So I would need
I think there will be a staffing plan amendment that comes to LNA next week that will address making it a position. And for clarification, this is something new that Al Schneider, and it's his interpretation of the law, and in looking other places in the state, what we found is it's done different ways, but it's an interpretation, and I think we have to follow his interpretation. So there will be a staffing plan amendment next week. Dean and Fred and Jerry have worked it out so that Fred explained it well, that he remains whole, basically, and he will just be an appointment of the board, an appointment of the board.
Okay. I would entertain a motion.
Go ahead. Bob.
Questions?
Yeah, so we know exactly what we've compensated him in previous 4 years, and we'll be setting compensation according to that. Is that what you're?
Well, we've already signed a contract for next year, right? Or approved a contract?
We have approved a contract, yes, but what Al's saying, when he reviewed the contract, he's saying the contract is not good because he has to be an employee.
But what you're saying is that the amount of money that'll be fixed as salary, whatever, will be identical to the contract that we've already agreed to.
Is that true, Jerry?
That's correct. He will have a base salary, and then he will receive additional compensation based on the units of service that he provides the county.
But I guess my question is, Jerry, if under a contract, it's a fixed amount for the base.
Yeah.
But in this case, it's a fixed amount, but then there's Social Security and those kinds of things
Yeah,
that we have to pay, FICA.
The primary difference will be, we will be paying the matching portion of FICA and Medicare, which will be probably in the neighborhood of $6,500. So there'll be additional costs.
There'll be a slight additional cost to the
About
company.
$6,500.
And what about benefits and so forth?
He's
There are
agreed to
no-
none.
Okay.
You would not be receiving any benefits.
Okay. Did you make the motion?
I didn't.
No.
Oh, okay. Okay.
You want to?
And this would be a different resolution number. This is the old one, right? 2005, so, but I would, well, go ahead.
Yeah, the sample resolution is from 2005, and actually, I believe LNA needs to do that. But, I mean, we can do it here and then
You wanna
have them
just-
confirm it.
So the change of status would be for LNA, and all we're doing is... Oh,
We're just doing the appointment
part.
part.
Okay.
Okay.
Well, I would move we change the status of Dr. Houghton, the county medical examiner, from contractual to employee.
And reappoint for another 4 years?
Well, she just said that would be up to LNA.
No, actually, it's the other...
It's the other way
It's
around.
the other way
Other way
around.
around?
I'm sorry, did I misunderstand?
We appoint here,
Oh.
don't we?
Actually, this resolution is for appointment, so
Right.
you can just,
So is the whole thing for LNA?
I think that works.
Hey, there we go.
I think that works.
All right. I would so move then.
yes,
That we
that's fine.
refer it.
All in favor, aye.
Aye.
Okay.
Okay. Grant acceptance, Fred?
Yes, grant acceptance, I believe it's page 20. The Regional Community Foundation has offered the Health Department a grant of $1,500 for infant safety campaign. This grant is to the Regional Foundation Healthy Youth and Healthy Seniors Endowment Support, specifically purchase of car seats and cribs for the program. There's a letter attached. A lot of these smaller grants we accept without prior approval, but the rules or guidelines we had is anything over $1,000 I present to this committee first. So we're coming to you to ask for acceptance of this grant.
And-
Okay, good. Oh, sorry.
I'm sorry. And Fred, there's no matching
No.
with this? Okay.
I move that we accept the grant in the amount of $1,500 from the Community Foundation.
I'll second that. I have a question.
Certainly.
So do you work with the Safe Kids program with MSUE then on the actual distribution of the car seats, or how does that work?
Hi, it's the Peacock Health Department. We do. Actually, the grant is for an infant safety campaign that we just identify people who have needs for things like that. We always refer to North Shore Safe Kids for the car seat first, or DHS, because those are both resources that provide car seats. The only time that we actually use this kind of funding to provide a car seat is if the infant is a preemie that maybe doesn't fit right in the convertible car seat that North Shore and DHS provide. Most of the time, it's porta cribs for people who don't have a place for their infant to sleep.
Oh, okay, so this is like a different kind of car seat than what they're dealing with then?
Yeah, and
Okay.
like last year, we had a different grant that provided this, and we provided probably 30 porta cribs and 2 car seats. so.
Oh, okay, okay. Thank you.
Lisa?
Okay. We have a motion on the floor. All those in favor, aye. Aye. Opposed, same. Motion carries.
Every year, since I don't know which year, we had an increase in environmental health fees. We at one time had increased our fees for a period of time, and then when we adjusted them, it was kind of a sticker shock, and so it was resolved that in lieu of doing approvals or increases in fees, that we just do it on an incremental basis yearly to keep up with the cost. And so for 2010, for the budget, we had put in a 3% increase in all environmental health-related services. And, but we need to have approval of that, which would initiate this fee change to start January 1, 2010. And I think there's a fee schedule in your packet.
Any questions for Fred?
I would move that we approve the proposed 3% fee increase to the environmental health services.
I would support that, and I just have one comment before we vote. My restaurant license in Illinois, I just got the renewal, it's $825. So honestly, the 427 looks like a bargain.
And just for clarification, the septic permit at 296, then 175 of that is with the septage, is that right?
For just septic system permit, 100 and, I think it is $175, $180 is for the septage fee.
Okay, and that's included in those prices right there?
Right,
Okay.
so, yeah. Take it off.
So that 175 goes to Board of Public Works, and the rest goes to you folks?
Correct.
Okay.
I have a question, Fred. On the fee schedule, I'm not seeing, and it may be here and I'm just not seeing it, Long Lake has an inspection, and I believe the health department's involved in that in some way?
Well, this is a referral, is that if they have if in their inspection, if they find that there's a problem, then we go out and do an evaluation, and if in fact we agree that there needs to be like an upgrade of the septic system or moving the well, then these fees apply.
Okay, thank you. All right, we have a motion. All those in favor, aye.
Aye.
Opposed, same.
Now we're going to jump to the adolescent health clinic. Page 45 and 46. Okay, as you know, that originally in the governor's recommendations for balancing the budget, they in the two houses of the legislature, at one time they had eliminated all funding for adolescent health clinics, and we received about $175,000 a year for on-campus clinics, and it's $225 for off-campus, I think.
Yes.
Yeah, $225 for off-campus. So we have an on-campus one at Youth Health and Wellness. Then we went into this nebulous area of not knowing where we were in the budget, and finally it shook out is that for the Youth Health and Wellness Center, we received a cut of 10%, or $17,500. We were offered several alternatives to how to compensate for that. One was to stop certain services, but the services they cited seemed too central to the services. How would you? One of them was mental health services, and so many of the young people who come in are going through a crisis of some sort. So it seems like cutting, saying, we'll talk to you about your sore throat, but not about your suicidal tendencies or whatever.
Yeah.
Didn't make sense to us. So that wasn't an option that we wanted to discuss. Another option was that we could close the clinic for 4 weeks. And that wasn't an option either fiscally, because under unemployment rules, we'd have to pay unemployment for people that we laid off for 4 weeks, and we wouldn't really realize any real savings. Another alternative would be to try to mimic the school schedule, so that days that the school's closed for in-services or holidays, is that we reduce services then, and then perhaps move some of that staff into the health department to do other billable services as best we could. We do have some contractual staff that we could replace with our nurse practitioner staff, for example, on those days. But that's a tough one for us to really
You can't plan.
plan exactly as to how that would work out financially. And so I guess my hope was that the county would kind of trust us that we do our best to do this reduction of 17.5, but if we don't accomplish that, if we could get kind of underwritten that a bit, so that we would not have to pull all that from our fund balance to make up that difference. I'm kind of dumping the problem here.
No, it is a problem, Fred. I strongly support the county funding the Youth Health and Wellness Center. Dennis, I heard at one of our last meetings that Commissioner Fleece was asking if we would consider taking $25,000 out of this year's budget and moving it to next year for Civic Center South. Is that some kind of option for us in this particular instance?
Well, I think what Commissioner Fleece was suggesting was that we take $25,000 out of this year's fund balance and pay it to Civic Center South this year in lieu of making an appropriation out of the budget for next year for Civic Center South. So instead of making an appropriation out of the 2010 budget, he's suggesting take it out of 2009 and pay it now so it's paid before the end of the year.
That's what he suggested.
Okay.
So there isn't an option to take money out of this year now and put it into next year's budget. There is always the option of, and when February comes around and Dean closes out the books, if there's a positive balance at the end of the year, taking some of that money and appropriating it to a program. Of course, we have no idea whether there will be or not. And of course, that money, there was already 400 and some thousand budgeted of use of fund balance, so we'd be cutting further into the use of fund balance and that, so.
And you also, if I understand correctly, you don't know how much you would need. I mean, you're going to try to reduce costs to compensate for that, correct?
Right.
But you wouldn't need any more than $17,500.
No.
Well, if I could I make a comment?
Certainly.
I very much support Fred in this program, and his department does an excellent job, and quite frankly, I'm pretty sure that by the time this gets done, Fred will have made up that $17,500. He typically does, but there's of course no guarantee of that. But with our budget situation, what it is, it would seem to me to be, and I know this is not what Fred wants to hear, but it would be more prudent to say, Fred, if you're short, make it up out of your fund balance next year than making it out of a commitment out of the county general fund, because you have a very small contingency next year, and you're facing lots of other costs, and you've expressed great concern about using fund balance as it is. And I believe you've got a fund balance, Jerry, of $300,000 or more?
No, it's, more than 800.
Oh, okay.
So my suggestion is, even though I know Fred and I have talked, and he prefers to see a commitment from the county to make this program continue, that at least for this next year, that they look at their fund balance if they have a shortage to supplement this and keep it open. And still leave Fred the option, though, of looking at these other alternatives, closing on days the school's closed and things like that, if that's a practical option.
And I don't think taking it out of, potentially, if there is a shortfall, taking it out of the county health department's fund balance should be construed as a lack of support on the county. I mean, it's all county funds, but that would be my preference is, I would expect to say that you may not even see any money that you need to make up through some of your cost savings. And if you do, I think it would be appropriate to take it out of that fund balance.
Ross?
I too, strongly support this program, and, I think it's maybe a little early to make a decision, from our viewpoint, but, feel free to come back at any time and, pursue it, because I'm pretty sure there, you have enough support on the county commission that, we're not going to let you fail. We're not going to let you, shut it down to the point where services, services are hurting. I mean, we can talk about, obviously, some of the things we're talking about have nothing to do with with your program, but I mean, any money we spend now is money we don't have next year. So whether we, whether we say, oh, well, we have it this year, and so we can spend it now, and so we don't have to spend it next year, but if we don't spend it now, then we'll have it next year. So it's like the same thing anyway. What about the Kingsley Clinic? Was that, did you get any money from the state for that?
That is the other part, is that we had jumped multiple hurdles, and we're still in the running. And then, I don't know, a few weeks ago, they said they were going to fund 3 new clinics. And I think they had 9 to choose. They were in the top running, and ours came in 4th. And so it looked like it was a dead issue. Then KIT was notified that, well, maybe they could get enough money together to fund it for a 3-day clinic. And that would be roughly as much money as we get for our youth health and wellness clinic, but it would be off campus. In other words, we'd have to pay rent. But Kingsley rent is cheaper than other places' rent. And so it looked like it might be a workable thing at that reduced amount for at least a 3-day-a-week clinic. And Kit was promised that she'd find out yesterday so that I could report to you whether we did or we didn't, and she didn't get that report. So,
Okay, so it hasn't been denied, but you don't know for sure.
It's a wink, that's all we got.
Well, does it work for you then to just, keep us apprised and...
Yeah, I think that's basically what it is. It's just that you're in my role, you would definitely want to let your board know, here's what we're facing.
Yeah.
And we're scratching our heads thinking we might be able to do this without a major interruption of services, and if as long as everyone understands the school and the state and you, that there'll be days that when they have an in-service at the school, we just may be closed on those days, and rearranging our staff or doing whatever we can do to try to cut services, or save money and not without a major reduction in services. But it's a little bit guessy because we don't know exactly how it's going to come a year from now where we're going to stand. And of course, we don't know what the budget is. I mean, I'm thinking 2011. What's it going to be like in 2011? So it just makes sense to me to let you know what we're up against.
Well, and we're obviously facing the same thing countywide. We don't know where we're going to be, 6 months or a year from now either. Of course, what I could imagine seeing with this, you keep reading about what's going to happen in the state of Michigan next year, in 2011, and I would assume that we're going to be facing the same issues of reduced state funding going forward. At some point, we're going to have to decide how much the county will pick up, or to keep you open, which is something that I certainly want to do. So,
Well, Fred, I am, just me personally, am prepared to take it out of the general fund balance if necessary. If you see, I think it's extremely important to keep kids healthy and in school. I think it makes a huge difference to our youth, this clinic does. And so if you get into trouble, if you see that your services are affecting a cut in services are affecting negatively the youth that use this clinic, please come back.
Michelle?
Okay.
Okay. We'll just stay here for H1N1. I'm a little lost in our schedule here, I apologize.
Well, that's my fault, because I've
Okay,
got 20 minutes left. I'm sorry.
You talking about H1N1?
Okay, H1N1.
Page 33?
Page 30, yeah. Because this is, I thought that this would be of interest to you, because everything is old. The page 33 is actually the page that I showed you a couple of months ago of the August data. At that time, we had 3,200 cases statewide and 10 deaths. And we were hoped to have 100 million units of vaccine delivered by late October. Well, the epidemic hit, and by November 9th, it jumped from 33,000 cases to 47,000 cases and 38 deaths, and now we're around 59 deaths since I wrote this. And we finally got 1 million doses delivered to Michigan by November 9th, and that's been a real challenge of the last weeks, is trying to, I guess is what was medically indicated and what we could do physically to get what vaccine we did get to get it to the right groups that were the most vulnerable. And no matter how you probably saw me in interviews, people would say, well, how come we didn't do this school first, or why aren't we doing this group? We pretty well follow the CDC guidelines, but also studies had shown that in any influenza outbreak, it seems like schools are a festering place where influenza gets spread around and then affects the rest of the community. And there's several reasons. One has to do with the hygienic practices of kids in school. The other one is that they don't have the option if the person next to them is coughing and hacking to get up and move to the other part of the room or into another room. They're pretty well in their assigned seats. And so their ability to be isolated by distance from someone who's ill is not realistically possible. And so we had, the feeling was to really try, what the health department would do was to get the vaccine to those school kids. Using our private practitioners, Kit and her team did get vaccine to the pediatricians and the obstetricians to try to get that other high-risk group, the pregnant women and the very young children, and hopefully the children with high risk, taken care of. We did put 400 units over to the medical control. That's the people who oversee the EMTs in the community, to get them vaccinated because they're considered a higher risk. And we gave, how many units to Munson? 8?
Hundreds now, a couple thousands.
Of units to Munson Hospital to try to get their nearly 4,000 employees vaccinated. I think they have 800 nurses, I don't know how many doctors, to try to get them done. And so that meant that people like internists and others who had some of the people at the other end of the spectrum of the risk levels, the people 25 to 65 with some pre-existing conditions, had to wait. And but we pushed that out. Meanwhile, the epidemic hit, and if you saw the chart on page 35, which I found pretty fascinating myself, is this was the first year we've plotted. I got a daily report on how many children were sick, and we were in early October anyway at 40 to 50 children sick at a time. Oh, these numbers don't correlate. Okay. And then on October 19th, we went from 40 to 50 to 289, the following day 434, then it jumped the next day to 654, 2 days later 755, and that following Monday, October 26th, we had 1,326 kids out with the flu, or at least flu-like illness. And the schools, and I have to say, lots of compliments to TCAPS in particular, but schools in general, communicated with us and said, what are we going to do? And I read in the CDC guidelines if there was a school closing, that they were averaging 2.5 days, and the CDC said that 4 to 5 days was better to break the chain of infection. And I said, well, if we're going to close, why don't we close, talk about 5 days? And that worked out with some weekends so that it didn't have to be 5 school days necessarily, maybe more like 3 school days. And they were cooperative on that, and TCAPS, and when we would talk to the principals, the schools, we say, how many kids are absent? They said, well, 20, 22, 23%. And one of the questions I asked them is, well, how many are sick right now at school? And the school nurses say, oh, I got a whole bunch of kids out in the hallway waiting to see me, and a whole bunch of others waiting for their parents to pick them up. So it seemed rather explosive. I mean, like when it hit with a vengeance. Where my son goes to school, they had like 8 or 10%. The kids were off on the first part of the week, and the day they closed, it was around 68% of the kids were off. In fact, the principal really didn't know. He's like, it's a high school, and a lot of kids are just leaving there, so they're ill enough. So when it hit so hard. So by doing that, we closed that. Then you notice that when school resumed around November 3rd, it dropped down to 400, and it consistently went down. And the numbers, I don't have a latest date, but they've been less than 200 have been absent. So we're almost back to a normal season. Now, that doesn't solve the problem, but it broke the chain of infection, and it seemed to overall lessen it. And so it was one of the tools as health officers we have is to do that, is to break this. I got some criticism from the state. They thought that maybe we overreacted, but other state epidemiologists come to my defense and said, no, look at the data. Because I sent this graph to the state and said, well, look at this. What does this say? And so, again, Dr. Collins was so valuable for us through this whole thing to have someone that we could work together. We'd do on conference calls with the schools and did that. But so, I'm pretty much against closing the schools, but it just didn't make sense to not do that. So we proceeded with the immunizations. At the schools, we had a fine team. Our environmental health people stepped forward and put together with some plastic water pipes and shower curtains, made these little room dividers so that we could set up clinics most anywhere. We had one large clinic at the mall. We immunized nearly 1,000 people that one day, the high-risk folks. We started with the schools, and that one chart on page 36, there's 2 columns. The column to the left, actually there's 3 columns. The column to the left starting at the top says 28, 39, 67. That was our very first, we got our first shipment of vaccine on the 23rd, the 24th, we had a clinic, and these are for physicians. The 28 is for the mist, the 39 is for the injectable form of the vaccine, for the total at the far right column. And then the next day we did the community clinic at the mall, so we'd had the vaccine for less than 48 hours. We were pushing it out there. And then we commenced to doing West Middle School being the first school that we did and went on. Another thing is that it's easy to kind of criticize young people, these teenagers, etc. I went to a number of these clinics. I have to tell you, they were so well behaved. I mean, it really, really was. It was kind of I was very impressed. I went to Central High School, for example, and I thought the kids were great. The school was very cooperative. One of the nice things is they could call up their school roster IDs so that the first station the kids went to was to verify that is the person getting vaccinated, which is very important for us to have, that our records are right. And then they were able to pull their permission slip from their parent, go to the next station, nurse would evaluate them whether they should get vaccinated, if they should get the live virus or the spray, or if they should get the injectable, and then they were given a token to that effect or on their sheet, and then they waited, and then they went in and got vaccinated, then they went into the library and sat. That was pretty much the system that we followed through the process, and it worked very well. Elementary schools, of course, we did late as school got out so that we could vaccinate. We wanted a parent or someone there present because we thought it'd be too scary for a little kid to line up and get an injection. For some reason, this mist sometimes scares kids more than the injection, which doesn't make sense to me. They seem somehow putting up their noses.
Why not in my household? Like, give me that mist.
Oh, good. You're our poster children for next year. But anyway, that worked. As of the time I wrote this on the 17th of November, we had done 3,824, mostly children. Of course, that number is larger than that now. And I think that we had gotten out at that time around, was it 8,000 doses to, or 5,641 doses to local providers. Now, in the last week or so, the vaccines, and part of the reason the holdup is one of the manufacturers was getting difficulty getting it out. Now it's out, and so we have plenty of vaccine. We're going to finish up the schools this week.
Next week.
Next week we'll be done with all the schools. Meanwhile, we have an open clinic at Environmental Health there at the Public Services Building because we just don't have the space at our building now. Where Environmental Health, we do have some space. So their plan review room / conference room, we've converted into with a divider made into two vaccination sites of 2 nurses. And then we use the Environmental Health reception area where we review their records and do the business part. So there's some chairs out in the hallway outside of reception for Environmental Health for people waiting to go in, and there's some post-vaccination chairs outside for people who they have them wait for a few minutes afterwards. So that's now getting the rest of those high-risk groups. There's also for children who need a booster shot. If you know, children under 10 need to have a booster shot for the vaccine.
So Fred, when is the next public clinic at Lafreniere?
It's every day.
Kit Mikovits. I'm Kit Mikovits, personal health manager. Every day we have appointments over there, and I'm doing them by appointment simply so we can not have a crowd control issue. Then we have a public clinic in Kingsley this Saturday for the people in the south end of the county.
And that's going to be located at the
library in Kingsley.
right. They've been used to letting us use it. That's where we had our public meetings for our adolescent health clinic. Kingsley, a neat little community. They're pretty stick together, and they've been very accommodating for us, and using that library site. So yeah, we're going to have that, and then we'll just see. I mean, we'll just how long this goes on. We were talking. I just saw in a memo yesterday. Is that in the next couple of weeks we have to sit down and start having a de-escalation plan of how we're going to close this down eventually, because this is going to go on forever.
Can I say something about yesterday?
Yeah, absolutely.
Yesterday there was a teleconference with the state, and they're looking at opening it up to anybody that wants the vaccine, probably the week before Christmas. They're kind of debating on the time, but vaccine will be shipped to pharmacies probably in the next 10 days, so that people can walk into Myers and Rite Aids and whoever is agreeing to take the vaccine from us and be able to get their vaccine there. So there'll be more availability for the general populace. Right now, it's still limited to the under 65 with chronic conditions and the other groups that, the other target groups.
And Fred, what about the regular seasonal flu vaccine?
Still a shortage. I'm still due 170 doses from the manufacturer that I've never gotten. I think we have 20 doses in the building. There's still quite a shortage on that.
This is a peculiar arrangement. It's just there's been very little of the seasonal flu has hit nationwide, and it's a phenomenon that scientifically there's no well explanation as to why this one form of flu seems to be dominating and the other one isn't around. And only thing is that seasonal flu usually hits January, February really hard, so we may get an influx of seasonal flu then. Because this whole epidemic is a topsy-turvy. It's hit young people rather than old hardies, and it started in the summertime. And we hit our peak in October, which is pretty backwards. If I could just say publicly, is that TCAP schools, the other public and private schools have been phenomenal to work with. The physicians in the hospital have been good. Our staff has been wonderful, and we have this flu team that has headed up, have done a great job. We have the rest of the staff. I mean, when we go through these statistics, one of the points that I think about is you don't see a sudden drop in our services. We went through this thing, and still people got their planning, thank you, the services. We've gotten our regular immunizations and WIC programs, and I think that's a really phenomenal thing. Of course, we added on staff, but still, it isn't like we froze and just thought about one thing. We were still able to carry on our services.
I know, I went to the flu clinic that was at the mall, and I knew several people who were there, and not that anybody wanted to be at a mall on a Sunday getting a flu vaccine, for sure. Everybody had better things to do, but I think most of them felt it went, pretty smoothly, and they were just glad to have access to the vaccine for their infant or, child who was high risk, so forth, so.
Okay.
All right.
Otherwise, I'll just start with my statistics then. We'll move the kits here first. This is really, well, maybe we should just start from the beginning, or otherwise I'll forget something. I know the chair has to leave here.
Yes, in about 3 minutes, and I do apologize.
Gary, did you want to talk about this CPBC comparison? Just to let you know where we stand, this isn't all of our funding, but the million or so dollars that we get from the state for comprehensive planning and budget.
Excuse me a second, Fred.
Yes.
For the commissioners, I asked Chris to check. We can't get a hold of Al or Bob this morning, but she talked to Linda Coburn, and Linda indicates that the meeting must be adjourned when the commission chairman has to leave, because you cannot hold a meeting with two.
Right.
So just wanted you to be aware of that.
Thank you.
So basically, Fred, you got 2 minutes to tell us what you want to tell us.
Well, I could,
Then we're done.
I just have to walk over to the courthouse, so I mean, but I have to get through security.
All right, well, the big question is how much did the cuts affect us? And this is going to defy logic when you first looked at it, because overall we're going to get $281,862 more. Most of that, though, was for the flu pandemic monies that we received for H1N1. We did get a sizable cut in family planning of $22,529, which reflected in our budget, and we have reduced the caseload some. However, the word on the street is that we may get 2/3 of that back sometime around the first of the year. And then this vaccine quality assurance program was reduced by $5,000 because more local providers are receiving vaccine directly from the producer rather than through the health department as they had in the past. So our responsibilities are reduced. And then we got a slight reduction in his maternal infant health advocacy program. So otherwise, that wasn't as affected. And you want to add to that?
No, there just really weren't any surprises when we got our contract. We had anticipated the decrease in family planning, so that's already reflected in the budget, so I don't think there's anything of major concern.
I'll go through these quickly. Food service reports, nothing really remarkable about this is that the numbers of regular inspections and re-inspections, when you have to account that you're seeing 10/12ths of the year in the far right-hand column or 209 are relatively predictable. Certainly our septic and well permits reflect the economy, although they're a little bit less than they were a year ago, which were very low. but it isn't, it is kind of held its own at issuing 192 septic tank permits for the year. And it's this cumulative septic tank permit and well permit indicates we're definitely still down. Animal control services have remained about the same. We still aren't getting as many dogs and other pets turned in from people who have lost their homes as we did last winter and spring. And the number of dog seizures is a little bit down actually in some services, or some months. Again, nothing really remarkable in that. We did an H1N1 update. Communicable disease report. The one thing that really stands out in this is in 2008 we had a total of 188 reportable sexually transmitted diseases. At 10/12 we were at 237. A lot of gonorrhea and particularly chlamydia, and seems to be within just certain groups of people who are not taking precautions in their sexual activity. Animal bites are somewhat up. No particular explanation on that. Family planning services are scheduled. They're holding their own about the same. Youth health and wellness, we continue to be very active in that. The only significant change here is that dental services ended in June 30th of '09.
Fred, which one of those line items includes school physicals?
Well, health promotion is where that usually fits in, but as they do the physical, there's something that fits in there for an additional service, well then it's spread around the nose, but that would be the general physical.
Thank you.
This shows unduplicated services as of end of October. It was 1,070 versus 1,100 for all year 2008. So that number of people we're seeing, but the number of services are considerably up. I think that's where some kids have come back for additional services. So when you look at this chart, the blue is the number of people, the green being the number of services. Actually, for 10/12 through the year, our services are up by like 500 units. We talked about adolescent immunization data, relatively same, although, you know, as I mentioned, is that more physicians' offices are accepting vaccine, which is a good thing. We like to have people go to their physician rather than to come to us for vaccinations to get a full picture of their health. And that just shows the trends for the last 4 years on a per month basis for immunization report in the health department. You want me to stop? Anyways, just say
Fred,
something.
I'm going to have to. I am sorry, but I'm going to excuse myself and adjourn the meeting.
I just wanted to offer condolences to Fred and his wife and family. His mother-in-law passed away this past weekend, and the funeral is Friday, and so we just wanted to offer our wishes
Thank you.
to Fred and his family.
Okay, then I just stop then. Okay.
Sorry.
Well, the rest of it's pretty much data. In a few months, I'll have the year-end report for you.